The Centers for Disease Control and Prevention came under fire during the pandemic and suffered a sharp decline in public trust. The government has received recommendations to revive the agency from a group led by Steve Morrison. He's Senior Vice President at the Center for Strategic and International Studies. Steve, welcome to the program.
Thank you. It's a real pleasure to be with you, Mimi.
You write that the CDC has entered a moment of peril. Why? What does that mean?
What we mean by that, and I want to mention that, this effort started at the end of August. It was on a very rapid basis to analyze CDC, and we started with this very premise that CDC had entered a period of peril. And what we mean by that is that trust and confidence from many different corners of American society has declined to varying degrees, but that is terribly important measure. That's the coin of the realm for public health institutions. It's part of a broader phenomenon of a rising skepticism of science and public health institutions writ large. And it's not simply limited to the United States, but we've seen this sharply happen with CDC, and we've seen stumbles in performance, repeated stumbles in performance. And we know that the storm clouds are forming in terms of investigations and the like. And we are anticipating that in the coming year, in the course of 2023, things could get rougher. And so we began this effort, a very bipartisan, mixed effort with talent and expertise coming from multiple directions. We formed a working group, several different former CDC directors, a former FDA director, people drawn from public health, corporate sector, philanthropies, and people with lots of senior level experience, Republicans and Democrats. And we also did a deep dive in terms of consulting with governors and others privately. I did this jointly with Tom Inglesby from Johns Hopkins University as the co-chair, who is a wonderful partner in doing all of this. So there's a sense of urgency. There's a sense that CDC is something which the American people need. They need a high-performing, reliable source of excellence to protect American people. It's something that we need to have as a national asset. It's a matter of national security. So those were the starting points for this effort.
And Steve, the CDC director, Dr. Walensky, has called for an overhaul. Have any significant changes been made so far?
Dr. Walensky announced around August 11th of last year that there would be an internal reform process called Moving Forward. She admitted some very stark mistakes. Obviously, the most notable and one that most people remember is the stumble over testing early in the pandemic in the first quarter of 2020. But she made this admission. I think she earned a considerable amount of goodwill in simply saying that, owning that problem, and saying that the CDC leadership and CDC's population was going to do a lot of soul searching, and according to 4 or 5 lines of work, begin a process of internal reform. They brought in a couple of very senior people to assist them, Mary Wakefield, most notable, Jim McCrae, and others. That effort, we are awaiting the rollout of some of those provisions. Dr. Walensky's talked most recently about the requirement for all CDC employees to be trained for emergency deployment and the like, and that it's be part of the generalized obligation. That's an important step, but there are many others that await action, and I think that this will be watched very carefully.
And Steve,
we're hopeful. We're hopeful that she will be able to move forward. But I want to make one point, Mimi, that the power to reset CDC, and we can go into detail on this, the power to really bring about a reset of CDC that will improve its performance and raise trust and confidence does rest with CDC leadership owning the problem in a really serious way and not doing half measures. But most of the power lies outside of CDC, at the White House, at the Secretary of HHS, among senior congressional leaders, Republicans and Democrats in both chambers.
And Steve, I was curious about your recommendation about a move to D.C. for the headquarters.
Right.
How did Atlanta end up being the headquarters for the CDC, and why would a move to D.C. be advantageous for the agency?
Well, first of all, Mimi, I want to say we did not recommend a relocation of the headquarters to Washington, D.C. What we said was it was founded in Atlanta in 1946 in order, principally at that time, to serve the requirements of ridding the South and many of our military bases that were training there of malaria. And so it started with that history. It stayed there. It's obviously grown into what it is today, which is doing many, many things. Our study was focused on the pandemic preparedness and response functions. There are many other functions, very important ones, that fall outside of that, that are more long-term and focused on the determinants of health, environmental, workforce, chronic diseases, and the like. But what we did say was CDC in the halls of power, in the interagency process in Washington, it's a very weak player. In its communications with Congress, it's weak. In its communications with the American public, it is weak. It needs a much stronger day in, day out presence within Washington, populated by people with gravitas, training, skill, seasoned in how to maneuver and bring along an argument based on national security, on protecting the American people, that looks to both the domestic and the global agenda of CDC. That is missing, and they pay a huge price for that. So we're not saying they should uproot the headquarters and move it. We're saying they need to move to have a much stronger and durable presence in Washington in order to be able to be effective at dealing within the halls of power in the executive branch, in dealing with Congress, and in communicating to the American people.
All right, Steve. Well, thanks so much. That's all the time we've got. Thank you for being on the program.
Thank you so much, Mimi. I really appreciate you paying attention to this.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.